My name is Dr. Olutayo Sogunro, and I am a breast surgical oncologist at the Johns Hopkins Breast Center at Howard County General Hospital in Columbia, Maryland. Knowing your family history is very important, and telling your physician this family history is just as important. Why? Because we often get pigeonholed into thinking that we only need to know about the breast cancer or ovarian cancer history in our families. But a lot of different genes have been identified over the last decades, and we've found a lot of associations with different cancers, such as pancreatic and prostate cancer. So when you have someone in your family that has pancreatic, prostate, ovarian, breast, or any other type of cancer, it's important to note this information and be very vigilant about your family tree. So breast cancer risk increases significantly with a first-degree relative. A first-degree relative is your mother, your father, your brother, your sister, or your son or your daughter. Second-degree relatives are your cousins, your aunts, and your uncles. Having one single second-degree relative increases your risk slightly, but having multiple second-degree relatives can increase it even more. Genes play a very large role in your risk for breast cancer. We have identified multiple genes that are associated with breast cancer. The two most common breast cancer genes that we have identified are the BRCA1 and BRCA2 genes. They are what we consider high penetrance genes for breast cancer. What that means is that if you have one of these genetic mutations, the BRCA1 or BRCA2, you have a much increased risk of breast cancer. Some studies say up to 80%. If you have a first-degree relative that has been diagnosed with a BRCA mutation, you should bring this information to your physician if they do not already know it. The reason is because we often do genetic counseling for first-degree relatives of those with a BRCA mutation. When you meet with a genetic counselor, it'll be determined which types of diseases and mutations you may be at high risk for, because we have different genetic panels that test for different diseases, including cancers. If you are at high risk for breast cancer, that usually means that you've had a family member, a first-degree relative, who had breast cancer at a young age. For example, if that person in your family had breast cancer diagnosed at age 42, you should get a mammogram 10 years before they were diagnosed, so that would be age 32.